Vilifying the disease of addiction is a harmful practice rooted in stigma and misunderstanding. It involves treating addiction as a moral failure or character flaw rather than a chronic, treatable medical condition. This perspective is inaccurate, promotes negative stereotypes, and creates significant barriers to recovery. The medical reality of addiction, based on decades of scientific research, have established that addiction, or substance use disorder, SUD, is a brain disease, not a lack of willpower. Key medical realities include altered brain function. Addiction involves functional changes to the brain's reward, stress, and self-control circuitry. Over time, these changes lead to compulsive drug-seeking behavior, despite negative consequences. Genetic and environmental factors. A person's genetics, social environment, and exposure to trauma all play a role in their susceptibility to addiction. These factors are often beyond an individual's control, yet societal stigma attributes the condition to a personal choice. Like other chronic diseases such as heart disease or diabetes, addiction is manageable through evidence-based treatments. While it may be a lifelong condition, remission is possible with comprehensive medical and therapeutic support. The harmful effects of vilifying addiction include, but are not limited to: 1. Barrier to treatment. Stigma, including the fear of judgment from friends, family, and healthcare providers, is a major reason why many people with SUD do not seek or stay in treatment. A fear of disclosing their condition can also lead people to avoid medical settings altogether. 2. Poorer health outcomes. Negative attitudes and bias from healthcare professionals can result in lower quality of care. In some cases, patients may receive inadequate treatment or be denied life-saving medication for opioid use disorder. Insab would argue to these conceptions. 3. Self-stigma and emotional distress. When individuals internalize society's negative messages, it leads to shame, guilt, and reduced self-esteem. This self-stigma can increase stress and social isolation, which are significant relapse triggers. 4. Impedes public policy. Treating addiction as a moral or criminal issue, rather than a health problem, diverts resources and leads to ineffective, punitive policies. This includes underfunding research and limiting access to evidence-based treatment and harm reduction programs. How to combat addiction stigma. Promote compassionate language. Include using person-first language that separates the person from their illness. For example, person with a substance use disorder instead of addict. The National Institute on Drug Abuse, NIDA, provides a guide on preferred terminology. Educate with science. Understanding that addiction is a chronic disease is crucial to changing perspectives. Education should focus on the biological and environmental factors of addiction, not on perceived moral failings. Practice empathy and compassion. Treatment that is empathetic and non-judgmental has been shown to improve outcomes by building trust and creating a safe, supportive environment for healing. Advocate for systemic change, addressing structural stigma, the laws and policies that discriminate against people with addiction, is necessary to improve access to housing, employment, and healthcare.